Well, I never really had any pain. I had limited motion, partly prescribed, so I wouldn't stretch things out. He didn't let me do anything for 6 weeks beyond walking. So once I never had a problem, and he was concerned I was going to overdo it, which I would have if he wouldn't have told me specifically what not to do. But it was easy, and it was fine. I never had pain. I had limited motion initially. I would say at 6 weeks I was totally fine. I might have even hit a few wedges before he let me, but we won't tell him that. Actually, I think he already knows that. My name is Peter Rossler. I'm an anesthesiologist in Portland, Oregon, and I've worked with Dr. Ballard for close to 15 years probably. The pain that I had in my hip started about 5 years ago, and it was subtle, and I thought that I might have some soft tissue injury, a labral tear or something that a young athlete would get. And the first thing that we did was got just a regular x-ray, and that showed the degeneration of the hip joint. And at that point, Dr. Ballard knew that I was on the way to getting a hip replacement. Little things like putting on my socks, tying my shoes. I'm pretty active around my property as well, and cut trees down, and I use equipment, and all those things were difficult. And it got to the point where it was really very difficult to get things done that I needed to get done. I could have chosen a lot of people, and we're very lucky here in Oregon to have a tremendous population of really skilled surgeons. As I mentioned, I've been working with orthopedic surgeons for over 20 years, and I've seen them work. And I've seen Dr. Ballard work for 15 years. And he's amazing technically. He's a genuine human being. He's smart. He knows what to do, and he knows how to do it, and he's nice about it. You know, you have to have a relationship, I think, where trust is a foundation, certainly. And enjoying somebody's company is probably not essential. Somebody can be a jerk, and yet if they do a good job for you, I mean, that's fine. It's like somebody comes over as a plumber to fix your plumbing. If he does a good job, it doesn't matter if, you know, if they were kind of annoying. But Jim is neither annoying or in any way unpleasant. I enjoy his company tremendously, and the trust that he develops with his patients, not only me, I've seen it with hundreds of patients of his, is genuine. And he cares about his patients, and he is honest with his patients, and he will tell you what needs to be done, he'll tell you what can be done, and he tells the truth. You know, what was really very helpful was that he treated me like a regular old patient. He didn't talk down to me. He didn't talk above me either. I was a patient. I'm an anesthesiologist. I'm not an orthopedic surgeon. I have the same questions a lot of people have, and I don't know the answer. Just because I'm a doctor doesn't mean I know the fine points of hip arthroplasty. So I asked stupid questions, like I'm sure a lot of people do, and I got thoughtful, complete, great answers. So the trust that was developed as colleagues translated into the trust that I had as a patient with Jim being my doctor. I came into the hospital at about 5:30 in the morning for a 7:30 case. I was out of the operating room an hour and a half later and was up in my room. I was walking around probably 3 hours after surgery, maybe 2, and I went home the same day with a total stay in the hospital of something like 12 hours. You know, from 5 a.m. to 5 p.m. and I was home. It was so minor. The whole procedure was so minor. It was a very easy transition to home. I had purchased a walker and crutches and all these things. I used the crutch because he made me for about a week, but I didn't need it. And the walker is still brand new. If anybody needs a walker, I've got one cheap. I am 100%. I am 100%. I'm doing everything. I am pain-free. It's like it was never there. And it's been that way for months. It's been there for months. You know, I joke with him that he doesn't often save lives as an orthopedic surgeon, but he saves lifestyles. And he has returned me to total function. I am looking forward to skiing again this January with my buddies. I'm doing everything that I want to do. I'm, you know, simple, you know, upstairs, downstairs. I mean, that's a non-issue. You know, carrying stuff around, non-issue. Climbing up on a ladder, non-issue. All that stuff is normal. It's completely normal.